your elbow's gone stronger or something. You trained it.
Had my Wheaties this morning. That's right. Yes.
Wow.
Got it.
That's a lot of deep work.
Yeah, that was a lot.
You good?
What am I doing? You know my issues.
Sure, yeah.
Pretty much, you know what I mean? But
Said reheating the clay.
yeah, so like I said, I have been sitting too long, so I had to take the certification for 6 months. I was sitting, so my whole routine was the dental, I wasn't doing it. The over the neck traction, I wasn't doing. I just got into this routine of not doing it anymore.
For those not familiar, I use the word clay as our spine is made of cartilage when we're young, and as we get older it becomes mostly bone, and then it becomes harder to change the posture. And so whatever position we're in, we tend to stay in. So in order to change our posture, we have to make the spine warmed up, get it soft like metal or clay, so we can reshape it.
During those 6 months, I developed crucial pain again. Hand symptoms, neck, but I did 2 sessions of the dental roll,
Okay.
and immediately the pain started going away. It's crazy how effective
Where's
it
the
is.
the largest symptom you're feeling right now? What's the current?
The lower neck,
Lower neck.
and it kind of shoots down to my mid back,
Okay.
and a little bit into my tricep and my forearms.
Let's see how we're moving here. Take one deep breath in. Let's see how your middle back's moving here. Exhale. There we go. Good. A little bit higher. Checking this middle back movement. Exhale. Here we go. Yeah, wow. What was right there? All right, deep breath. One more. Let it go. Let it go. All right, okay, work it up there. Yeah, okay. Let's have you scoot down and then on your side. Oh, yeah, breathe for me. Breathe. Relax your arms. Put them around your belly. There we go. Relax. There we go. All right. Breathe. Exhale. All right, good. That's it for me. Breathe. Try to twist. Exhale. I know. Come on. Come on. Okay. There we go. All right, good. Face up on me.
That makes me stubborn.
Yeah. All right. So for everybody at home, we're C5 is right about here, so the lower neck. And if any chiropractors adjust the lower neck when there's a lower neck disc injury, all it's going to do is further aggravate it. So make sure that kind of leave this area alone, even massage-wise. We don't want to be further bending where we're already over bending. We want to unlock the areas above, so the atlas and axis up here in the upper cervical, and then we'll work on his upper back. Earlier, that's when I was adjusting his upper back. We were targeting the vertebrae up there, and if the upper back is tight, it lends to the lower neck overworking. So we work on the areas above and below to take stress off the lower neck. And so we're about to adjust the upper neck, make sure that it's the main engine as it should be. Gotcha. Easy, let it go. Very nice. Wow, very nice. Yeah.
You know, I've done this so much, but every time I get adjusted in the neck, it's like extreme surprise, you know. Insane.
You know, the joints in your neck are much more stable when there's a curve in your spine. And that also reduces the amount of workload that C5 is having to take. In order to pivot at C5, you have to have no curve in your neck. The curve has to be straightened for C5 to be the pivot point. So to wear out C5, we have to lose the curve first, which is what typically happens from the age of 5 to 20. We don't value the curve, we lose the curve, and then we live our lives in the wrong alignment. We lift weights, all these sort of things. Then we're just utilizing the parts that are loose when we're out in real life. And so keeping the spine supple, keep the clay soft, aim the spine back to its curve. There you go, you're doing great.
Yeah, so like, I was gonna ask, like,
Please.
because I haven't grown up in the U.S. I moved, you know, I was a teenager, but like, when kids are growing up in the U.S., is,
Yeah.
like, part of the annual exam, does it require an X-ray or not really?
No, there's such a poor. The level of physical exam that's typically done on a kid in America would be the same if I went to a dentist and they said, okay, open your mouth, shut your mouth, and go ahead and smile for me. Okay, your teeth are healthy. Most chiropractors aren't even really talking about lordosis or curve. So my profession itself has a problem, not even the public.
Yeah, because like my whole curiosity is, let's catch things so early. it's like a tree when it's growing.
Sure.
Make sure you put you
Right.
put a stick and let it grow straight.
Right.
But if it's already growing up and it's like you can't do much, so I'm like, let's make this mandatory. And
We live in a world where very few people are going to orthodontists, would be the better way to put it. We have dentists, but we don't have orthodontists. So I was 12 years old and I was told that if I didn't have braces, that my bottom teeth were going to wear out prematurely, that my overbite was going to cause excessive stress on my lower teeth. He didn't tell me he believed that. He didn't tell me he thought my lower teeth were going to wear out. He said this alignment will cause a problem at 30. So we're going to invest 2 years and thousands of dollars to shift the position of your teeth so you'll actually have teeth that'll function past 30, right?
yeah,
Right, but we don't live in a world where there's spinal orthodontics, right? So we just wait till the spine wears out and then we react.
yeah, and I think it's more of for the teeth, not to bash on any
Sure.
dentist or whatever, but I think it's such a more visual thing, and people are like, "Oh, teeth gotta look good," but like
Right.
spine is inside your body.
Right.
Unless you're like have severe of kyphosis or
Right.
scoliosis, people don't really care as much.
It's harder. Yeah, I don't.
Teeth get more love than the spine, but the spine has much more functionality.
Like no skin, your back was like completely open. You can see somebody's spine through the body. And I think people would put much more love into the spine, just like the teeth. If your spine can smile, then people I think would want
That's
to
true.
do more to it, right?
Right, well, it's.
We're too superficial beings.
I can't tell you how many. It's actually one of the first things that I do a lot of on new patients is I actually just take a photo of them from the side so they can see it. Right? They don't even notice it.
Yeah.
I had one lady once. She was I don't know, just to say very, into her the way her her shape and her body and all that sort of thing. And I was like, well, I said, you do have this hump in your upper back. And she was like, what? I was like, well, there's a hump here in your upper back, and it's, your head is forward. She's like, no, it's not. This is the way I was standing there. Take another picture. I was like, okay, show me your best posture. I took another picture of her. See? It was like total denial. I'm like, well, your head's forward. And, we're not aware of it. We're not even being shown it. And what are the long-term effects of not changing it? Anyway.
Yeah, I mean, I would not have this much of a fascination about the spine itself until like if I didn't get injured and didn't have these issues.
Right.
So it's like until you feel the pain, you're like, well, something's got to be changed in this whole system. Oh. Yeah, I think the fact that nowadays people breathe so shallowly, if that's even a word, but like they don't even breathe very deeply. That affects oxygen getting into the muscles and things, right?
Correct, along with posture and stiffness, injuries, right, that decrease the ability for blood to be pushed uphill, right? So an area that's really tight will have a hard time, like Mount Everest, getting it up to that level of pressure. I was thinking that Wizard of Oz scene at the end where they're going like, scrub, 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 clean, 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 the wonderful land of Oz, as I sweep your back with this comb.
It's getting painful.
Yeah, with the mobility of the neck being, you're not going to have a lot of mark. The mark will usually generally come out where there's the most restriction. So because the vertebrae are moving, you're not going to have too much grit come out. It's usually your upper back, I imagine, is going to have a lot more because of how tight this was.
Yeah.
So we're going to work on that in a second.
But it's very fascinating because me, if not doing any type of neck treatment for 6 months, jumped on the dental, did 20 minutes 2 days in a row, and then pain went away, vanished.
Is that normal, or is that just because he's done it for?
Yeah, his body will
so many-
resume.
Yeah,
okay.
yeah. I was doing it for a very long
Right,
time.
because you were very,
But then I stopped, and
ahead and press back with your elbow to my elbow. But no, yeah, good. Same thing, press. Almost there, relax. There it is, nice. Go ahead and tilt left for me. Good.
Oh man, that always feels weird.
Go ahead left, tilt left. Okay, nothing. Go ahead and tilt to the right. Okay, good. I got you. Go ahead, tilt right. Okay, good. All right. Good. Okay. All right, go ahead and lean back for me a little bit. Lean back. Good. Relax your arm. Relax. Okay. Lean back a little bit for me. Good. Go. All right. Let your chin go up if you can. Like, there you go. Try to practice, you okay?
Yeah.
I'm gonna bring that headpiece up a little bit. And what that does is it pushes your head back. So instead of just working on you in neutral, we're gonna start working on you with a little bit of extension. If it's too uncomfortable, let me know. I can put it back down, but you know, we try to actually now work on you more in extension instead of just working on you in a neutral position.
Okay.
If you can tolerate it, the more. Now, if we start feeling, you know, the shoulder or
Yeah.
elbow hurt, you know, we got to back off. But there we go. There we go. Yeah, I know.
Wow. Your elbow's gone stronger or something. You trained it.
Had my Wheaties this morning. That's right.
Oh, wow.
There it is, yeah, right there. Not the butt head. Right there.
Yeah. Is there, I was going to ask, is there like, with this whole AI type of technology happening,
Mhm.
anything on the chiropractic type of side of the world, or?
I guess I'll go to the seminar in a month and I'll let you know.
Okay.
I haven't seen much in terms of, I mean, they have maybe better massage chairs than they did 20 years ago.
Yeah.
You know, but, you know, you get on a massage chair, it's so mild compared to this level of pinpoint work. So until
Yeah,
they're
it's
able to-
difficult to. I was just thinking from a perspective of like something aiding the process.
Right. Right. I mean, there are like I said, a lot of them are doing a lot of traction work. I've been in chairs where they'll grab your legs and they're
Okay.
pulling, they're
Oh, okay.
extending in, pulling.
Yeah.
Which, you know, can be okay, I guess. But the difficulty is that when you traction a lay person's spine, where's it going to traction the most? Well, where they're injured.
Yeah, the loosest.
The loosest parts.
Yeah.
So we have a high proclivity to just further imbalancing people's spines by, you know, I don't know. It's supposed to be targeted, but the areas that are all stiff, like this part, this is not going to traction.
Mhm.
It's going to stay completely frozen.
Ooh. That's all that's sitting, man. The last 6 months.
Elbow 4.0. Exactly.
Man,
Did you upgrade the iOS or something? Man, what's going on with that elbow?
man, you got.
Had some patent upgrades to it done. Sharpened my Electronon.
It's definitely an upgrade or some patch. Yeah. Yeah, there was one point in the last 6 months where even chewing was causing some neck pain. Like towards the end of the chewing
Interesting.
of whatever bite, take a bite, I'm chewing towards like the last few bites. I'm like, my neck hurts. I can't even chew anymore.
Well, the muscles, the hyoid, they attach to the hyoid, and you're interacting with the vertebrae. When if you take a motion X-ray of somebody chewing, you can see the vertebrae in the neck moving.
Yeah.
Right. So you have a upset joint in your neck or a nerve that's close to the cliff edge. Just a little extra motion is all it takes to. We're made up of a bunch of holes with wires going through them. If you need a reminder, just look at that spinal model right there. We're a bunch of yellow wires going through little nickel-sized, dime-sized holes, and cooked spaghetti noodles going through holes. And so they change in size based on the health of the disc, our posture, bone growth.
Oh, crap, that's... That's the worst part. I wish I could find a study where, pre-computer TV era neck health versus post, before telephones, everything, and see if the same rate of lower neck and lower back injuries happened.
Well, my dad's been practicing for 40 years, and definitely will tell you that we have had more neck cases in the last 20 years than the first 20 years of his practice.
Okay.
More people are coming in with chief complaints being in the neck than 20, 30 years ago. So 100% it's trending to neck issues being more prevalent. That, and my dad would say the 80s and 90s, his practice was primarily geriatric. It was all
Okay.
50, 60 plus year old people. Very few people, when I was a kid in my dad's office were there, 20-year-olds. So definitely been a shift to younger care, more problems at a younger age.
Yeah, sadly, it's really young people are starting to get these issues. Yeah, the funniest thing is when doctors rule out disc issues just off of an X-ray.
Oh, next year, yeah. So
And I'm like, do I know more than you, or what the heck's going on here? Am I the doctor?
all you can really say is that the disc height could be maintained, right? But you can't
Yeah.
actually see the disc. You can see the space where the disc is, but you can't make any judgment on the health of the disc. I've many times in a 20, 30-year-old person, you can have a bulging, swollen, injured disc, but the height on x-ray looks great.
Okay.
So you are absolutely missing that disc herniation if you only take an x-ray of a young person.
Yeah.
Now, over time, 10, 15, 20 years later, when that disc now dries out and thins up, now we can see the evidence of disc injury on x-ray. But a disc that's actively rupturing out and hasn't dehydrated yet will actually look okay on an x-ray. Pretty
Yeah.
sad place, very sad place to be.
Yeah.
You are missing it.
Yeah, like X-rays probably help with curvature and stuff.
Alignment, right, and you can, if something's broken, dislocated, absolutely, and it's better than nothing, but it's way too much is attributed to
Yeah,
it.
and I talk to friends and they're like, "Oh, yeah, I'm having these symptoms," and they told me nothing's wrong with me. Like, what kind of scan did you get?
Right.
X-ray. I'm like, oh, God,
Right,
sit
right.
down. I gotta tell you a few things here.
Try to bring your elbows a little closer together. Yeah, is that okay? There we go. Good, good, good. There we go. Yeah, let's have a little trouble with this one. It's okay. All right, here we go. Breathe. There you go. Come on, breathe. Good. Okay. Arms down. You got it. Put arms down for me. You got it. There it is. Yeah. Yes.
Whoa.
Yeah. Yes. Yes, nice one.
You okay?
Yeah. Yeah, this has been the most intense visit for sure.
Yes. I'm alive.
You're funny.
Got it.
That was a lot of deep work.
Yeah, that was a lot.
You good?
What am I doing?
Go on your back. Help me get your toes.
Okay.
He's like, I'm disoriented.
Lay down on your back for a second. Take a nap.
Your eyes are like.
All right, let's try this guy. We've done this for a while. Go ahead and press out. Press out with your knees. Try to bring your knees out for me. As hard as you can, And now relax. Relax. Now bring your knees together. Try to bring your knees together. There you go.
Wow. That's an interesting one. I've never seen. You can crack that? How's that? What is it? What crack, man?
Beautiful. Cubic zipsus.
Man, and now I can do the dead roll and things will start moving again.
Yep.
It's not that we didn't, I mean, this was insane, but
Mhm.
I feel like when I was doing the dead rolls and the traction,
Mhm.
it wasn't as optimal as after this session.
Mhm.
And you get back on the routine, it just flows very well.
So how much of his back moved with the roller? I heard it.
Oh, we've got at least a
More
couple there.
than the few times I've been here, that has been
Just right there, what, T7, T6, T7, T8. with a-
tapped out.
Yeah.
Yeah, I feel really good.
Exactly, stretching that.
Amazing.
Awesome.
That's
Good
very
job.
good.
Do you
Very
want-
good.
Do you want to review anything with the generals? You feel like you're okay
Um,
with
I
that?
think, I've been using the thoracic one,
Mhm.
not that high one, the other one. What is it called? The flat thoracic one.
Got
Oh,
the trainer,
the
good.
trainer.
The trainer,
Yeah.
yeah. Should I continue doing that, or do you think just the neck will be fine for me? Or
No,
do
you
both?
need to use a trainer. You need, or.
Use the trainer.
Until we can start elevating it. If it gets too easy, we move up to the more pinpoint.
Yes.
You know, they both work together. You know, the effectiveness and the benefit of the neck guy is dependent on how much the chest has to come in, and then the
Yeah.
neck can come back. So I would encourage you to keep, 20 minutes in, or if you want to go back and forth, whatever,
Position.
but 100%. It allows you to move around.
Okay.
Hold on. Just, you're trying to go to the edge. You're trying to go to the edge of what you can tolerate without upsetting the C5. And time, 20 minutes every day.
Yeah, I've replicated this. I have I got a sock and I put 2 tennis balls in there, and it's not as elevated as this, but it kind of feels the same. But
Yep.
this is much better.
Like I said, yeah, your head, something on behind your head. So you don't
Yeah,
have one
this is
upset.
really good. Nice.
Yep. Like and subscribe and leave a comment. Yes.